There's an interesting one for you. Finding some evidence that limiting gatherings, just even limiting gatherings, not just the lockdown, was also counterproductive. This is an interesting study. All right, so this caught my attention. It was floating around on Twitter, and I believe Jordan Peterson actually put this out there. I am absolutely not going to go through this whole thing because this is a 62-page literature review and meta-analysis. But from what I read earlier today, I thought it was worth bringing up on this channel. And of course, I will link this in the description for you so that you can go have a look at it. But this is a literature review and meta-analysis of the effects of lockdowns on COVID-19 mortality. The biggest thing to point out in the conclusions up front, and this is a very seriously big review from Johns Hopkins, and so I make the point to point this out because it takes a lot of time and effort to do the kind of review that they're talking about here, and when we get into it and show you some of the details of it, you will understand entirely why. It is quite a big report. So, the abstract first, of course. This systematic review and meta-analysis that should be designed, but anyway, so systematic review and meta-analysis, R is fine, are designed to determine whether there is empirical evidence to support the beliefs that lockdowns, quote unquote, reduce COVID-19 mortality. Lockdowns are defined as the imposition of at least one compulsory non-pharmaceutical intervention, NPI. NPIs are any government mandate that directly restricts people's possibilities, such as policies that limit internal movement, close schools and businesses, and ban international travel. This study employed a systematic search and screening procedure in which 18,590 studies are identified that could potentially address the belief posed. After 3 levels of screening, 34 studies ultimately qualified. Of those 34 eligible studies, 24 qualified for inclusion in the meta-analysis. They were separated into 3 groups: lockdown stringency index studies, shelter-in-place order studies, and specific NPI studies. An analysis of each of these 3 groups support the conclusion that lockdowns have had little to no effect on COVID-19 mortality. For the record there, little to no effect on COVID-19 mortality from lockdowns. YouTube, I'm reading a study published by Johns Hopkins, by the way. More specifically, stringency index studies find that lockdowns in Europe and the United States only reduce COVID-19 mortality by 0.2% on average. SIPOs were also ineffective, only reducing COVID-19 by 2.9% on average. Specific NPI studies also found no broad-based evidence of noticeable effects on COVID-19 mortality. While this meta-analysis concludes that lockdowns have had little to no public health effects, they have imposed enormous economic and social costs where they have been adopted. In consequence, lockdown policies are ill-founded and should be rejected as a pandemic policy instrument. Absolutely, no more lockdowns. Don't do it, because it doesn't work. Anyway, doesn't do what you think it does on the tin, right? So that's the big point here that they put in straight away out of the gate. And what they mean by this is, the COVID-19 mortality rate overall is fairly low to begin with. They mean that the improvement in the COVID-19 mortality rate, which is already fairly low, is decreased by this percentage amount of that percentage, which means to say the COVID-19 mortality rate is reduced by a very, very tiny, tiny, tiny amount that does not justify doing all of this. So let's see. So there's a lot of stuff in here. There's a few things I wanted to go through that are relevant. And actually, this is the first one I wanted to bring up because they said 18,590 studies is what they started with. There was a lot of research done related to COVID-19 right when the pandemic started, and since the pandemic started, because at least in the United States and also in Europe, there is a process by which in these kinds of situations you can rush funding into groups to actually get these kinds of studies published on something that you have no idea what it is, but it's having a major societal impact all of a sudden, the way the COVID-19 pandemic did. And so there were lots and lots and lots of studies that were done here. And they wanted to make sure, because they were after a very specific question, because there was a huge number of studies done about COVID right when the pandemic started, but they wanted to focus on specific question. Does having a lockdown of some variety decrease the mortality of COVID-19? Those are the studies they wanted to analyze. So they had to make sure, of all those thousands upon thousands of COVID studies that have been done since the pandemic started, that they got the right ones. So this isn't an abnormal thing to do when you're dealing with a review or a meta-analysis of something, to try and parrot back to the question you're actually trying to answer. That's not to say it's perfect, because in a published study, you can ultimately, you can inadvertently end up, how do I put this? You can inadvertently end up answering a question that was not necessarily your original question that you were posing as part of the study. And it may not always be in the title, too. So let's look at some of these things. 18,590 studies identified through extensive database searches with Google Scholar and Scopus. Search was modified to catch references from identified reviews and dedicated COVID-19 portals. What do we mean by this? There was actually a lot of specific work that was dedicated to COVID-19. There was rapid grant funding and all those kinds of things. So there were dedicated portals for actually doing COVID-19 related research in the United States and abroad. So those kinds of places, obviously, you would want to look there because they were paying for that kind of research alongside of different database portals that were just specifically on COVID-19 because of the amount of work that was done very quickly. 18,590 studies were screened manually by the title, and they were looking for in the title, is it related to lockdown and deaths? And because of that they were looking in the title, 17,540 were excluded. So that would be the only critique I have of their method, is sometimes you answer a question and you don't end up writing it into the title. That said, I think it's probably fair to say they got it right because of the fact that, if you're talking about COVID-19 mortality and the newsworthiness of it, both in the scientific community and just in general news media and journalism, yeah, you would end up wanting that in the title to make sure it got picked up and sent out to folks. 1,048 studies possibly related to lockdown deaths and screening answers, and deaths screened answering measures effect of lockdowns on mortality and uses empirical approach, meaning did they use observations and data rather than a modeling approach. 931 studies were excluded because the answer was not yes to both questions. So 117 full-text studies assessed for eligibility. 83 studies were included because you had 14 duplicates, 14 only looked at the timing of things, 9 did not look at mortality, 8 used a modeling, 1 was a descriptive, 4 analyzed the effect of social distancing, not lockdowns, 9 were using a time series approach, 3 were student papers, 2 did not look at the effect of lockdowns, 9 had too few observations, and 10 were synthetic control studies. They were very specific in what kinds of studies they wanted, which involved the empirical data regarding lockdowns and mortality. Hence the reason 18,590 got reduced to 34 that got included in this study review. And that's okay. That's not necessarily a bad thing, but I'm glad they're very upfront about that and putting that in there. And that's why I wanted to mention it, is they did go through quite a thing here. So I'm not going to look at all of this. I am just going to show you some of the results that they had in their conclusions. So this is actually describes all the studies in brief right here. So I'm obviously not going to go through all of that. So yeah, metadata for the studies included whether or not it was peer-reviewed or if it was a white paper or a working paper is the other name for it. So, yes, stringency index studies. 7 eligible studies examined the links between lockdown stringency and COVID-19 mortality. So the more stringent lockdown, better at reducing COVID-19 mortality is essentially what those studies would have looked at. The results from these studies converted to common estimates are presented in Table 3 below. All the studies based on the COVID-19 Government Response Tracker Stringency Index of Harvard University's Blavatnik School of Government. Say that 3 times fast. The OXCGRT Stringency Index neither measures the expected effectiveness of the lockdowns nor the expected costs. Instead, it describes the stringency based on 9 equally rated parameters. So there's that kind of thing. This is about the stringency of a lockdown. But in here, where is it? So yeah, when they came to their concluding thing here, compared to a policy based solely on recommendations, we find little evidence that lockdowns had noticeable impact on COVID-19 mortality. Only one study, Fuller et al. 2021, finds a substantial effect, while the rest of the studies find little to no effect. Indeed, according to stringency index studies, lockdowns in Europe and the United States reduced only COVID-19 mortality by 0.2% on average. There are some typos in here. They were quick in typing this up, I'm noticing. Following section, they look at SIPOs. So, 13 eligible studies which estimate the effect of shelter-in-place orders on COVID-19 mortality, and that is with respect to your local government officials or to your state demanding that you stay home. In there, and that's what these are referring to. Did those orders from your state and local government amount to anything and matter at all? So that's the point that I want to make with that. So if I go down here, let's see, 7 of these studies look at multiple NPIs, non-pharmaceutical interventions, of which a CIPO is just one, while 6 studies estimate the effect of CIPO versus non-CIPO in the United States. According to the contaminant and closure policy indicators from the OXCGRT, 41 states in the U.S. issued shelter-in-place orders in the spring of 2020. But usually these were introduced after implementing other non-pharmaceutical interventions such as school closures or workplace closures. On average, shelter-in-place orders were issued 7.5 days after both schools and workplaces were closed, and 12 days after the first 2 closed. One state, Tennessee, issued a shelter-in-place order before schools and workplaces closed. The 10 states that did not issue shelter-in-place orders all closed schools. Moreover, of those 10 states, 3 closed some non-essential businesses, while the remaining 7 closed all non-essential businesses. Because of this, we perceive shelter-in-place orders based on the United States data as the marginal effect of shelter-in-place orders on top of other restrictions, although we acknowledge that the estimates may capture the effect of other NPI, non-pharmaceutical interventions, as well. What do they mean by that? They basically mean they recognize that some states went further than others with their shelter-in-place orders and lockdowns and things like that, and that there were some interacting effects. That's what they're acknowledging with this. So this is probably the case with the shelter-in-place orders, gives you the highest possible kind of, the most stringent of all stringent lockdowns. Let's put it that way. It might be in the shelter-in-place order category. So in at the end here, again, I will link this for you, so please feel free to go and look at it. Here it is. We find no clear evidence that shelter-in-place orders had a noticeable impact on COVID-19 mortality. Some studies find a large negative relationship between lockdowns and COVID-19 mortality, but this seems to be caused by the short data series, which does not cover a full COVID-19 wave. Several studies find a small positive relationship between lockdowns and COVID-19 mortality, although this appears to be counterintuitive. It could be the result of an asymptomatic infected person being isolated at home under a CIPO under a shelter-in-place order can infect family members with a higher viral load, causing more severe illness. The overall effect, measured by precision-weighted average, is minus 2.9%. The result is in line with Nuzzo et al. 2019, who stated that, quote, in the context of a high-impact respiratory pathogen, quarantine may be the least likely NPI, non-pharmaceutical intervention, to be effective in controlling the spread due to high transmissibility. And World Health Organization Group 2006, who conclude that, quote, forced isolation and quarantine are ineffective and impractical. So part of the reason I read this is because they're building on past literature. And there's plenty of past literature that say for respiratory viruses, quarantines and lockdowns don't work. It doesn't work to actually reduce mortality. Oh, goodness. So let's see. Oh, yeah, NPIs, the last one of their category here. Studies of specific NPIs. A total of 11 eligible studies look at multiple specific NPIs independently or simply lockdown versus no lockdown. The definition of the specific NPI varies from study to study and are somewhat difficult to compare. The variety in the definitions can be seen in the analysis of non-essential business closures and bar restaurant closures. Chernozhukov, 2021, focus on a combined parameter, the average of business closure and bar closure in each state. Aparicio and Gaspard, 2021, look at business closure but not bar restaurant closure. Spiegel and Tux examined bar restaurant closure but not business closure. So in other words, there's a bunch of reverse combinations. Guo et al. Look at both business closures and bar restaurant closures independently. Some studies include several NPIs, while others can cover very few. Bongartz et al. Only study business closures. Leffler et al. Look at internal lockdown and international travel restrictions. Few NPIs in a model are potentially a problem because they can capture the effect of excluded NPIs. On the other hand, several NPIs in a model increase the risk of multiple test bias. So they're stating some careful things that they have here, and they're stating the fact that not everybody's choice of how they did an intervention, aside from a stay-at-home order kind of thing, was exactly the same. So these were studies that looked at very specific things, and in a sense, they couldn't be categorized in either of the other two, was one of the reasons why they ended up here. That's my guess, actually, is probably part of the reason this category exists for them, is it was a non-pharmaceutical intervention that didn't quite fit in another category. So let's see. That's an interesting note. I didn't know that. Mandating face masks, an intervention that was not widely used in the spring of 2020 and in many countries was even discouraged, seems to have had a large effect. But this conclusion is based only on 2 studies. Good to know, right? That's a little nugget. I didn't know it was in there. I missed that before. So down to their conclusions. Because of the heterogeneity in NPIs across studies, it is difficult to draw conclusions based on the studies of multiple specific measures. We find no evidence that lockdowns, school closures, border closures, and limited gatherings have had a noticeable impact on COVID-19 mortality. Stop doing it. Please stop doing it. It's not helping. There is some evidence that business closures reduce COVID-19 mortality, but the variation in estimates is large, and the effect seems related to closing bars. There may be an effect of mask mandates, but just 2 studies looked at this, one of which only looks at the effect of employee mask mandates. In other words, the mask mandate thing isn't necessarily great either, but that's a whole different topic. YouTube, I'm reading from a study done by Johns Hopkins. And the only reason I'm saying that is because YouTube doesn't like COVID misinformation, and I'm not reading anything that is COVID misinformation. I'm reading directly from the science, as it were. Concluding observations. Public health experts and politicians, based on forecasts in epidemiological studies such as the Imperial College London, embrace compulsory lockdowns as an effective method for arresting the pandemic, but have these lockdown policies been effective in curbing COVID-19 mortality? This is the main question answered by our meta-analysis. Adopting a systematic search and title-based screening, we identified 1,048 studies published by July 1st, 2020, which potentially look at the effect of lockdowns on mortality rates. To answer our question, we focus on studies that examine the actual impact of lockdowns on COVID-19 mortality rates based on registered cross-sectional mortality data and a counterfactual difference in difference approach. Of the 1,048 studies, 34 met our eligibility criteria. Overall, our meta-analysis fails to confirm that lockdowns have had a large, significant effect on mortality rates. Again, they don't work. Studies examining the relationship between lockdown strictness based on OXCGRT stringency index find that the average... this is pretty much what's in the abstract, so I'm not going to read that. Let's see. Masks may reduce COVID-19 mortality, but there is only one study that examines universal mask mandates. The effect of border closures, school closures, and limited gatherings in COVID-19 mortality yields precision-weighted estimates of -0.1, -4.4, and 1.6% respectively. Lockdowns compared to no lockdowns also did not reduce COVID-19 mortality. So I don't want to necessarily go into all of this down here. I'm going to see if there's anything here real quick that's of importance. Let's see. Our main conclusion invites a discussion of some issues. Our review does not point out why lockdowns did not have the effect promised by the epidemiological models of Imperial College London. We propose 4 factors that might explain the difference between our conclusion and the view embraced by some epidemiologists. First, people respond to dangers outside their door. When a pandemic rages, people believe in social distancing regardless of what the government mandates. So we believe that Allen 2021 is right when he concludes, quote, the ineffectiveness of lockdowns stemmed from individual change in behavior, either noncompliance or behavior mimicked lockdowns. In economic terms, you can say that the demand for costly disease prevention efforts like social distancing and increased focus on hygiene is high when infection rates are high. Contrary, when rates are low, the demand is low, and it may be even morally and economically rational not to comply with mandates like shelter-in-place orders, which are difficult to enforce. There you go. That would be one thing they think. Second, mandates only regulate a fraction of our potential contagious contacts and can hardly regulate nor enforce hand washing, coughing etiquette, distancing in supermarkets, etc. Countries like Denmark, Finland, and Norway that realized success in keeping COVID-19 mortality rates relatively low allowed people to go to work, use public transport, meet privately at home during the first lockdown. In these countries, there were ample opportunities to legally meet with others. In other words, yes, you're talking about you can't regulate everything about human behavior. It doesn't usually end well. Third, even if lockdowns are successful in initially reducing the spread of COVID-19, the behavioral response may counteract the effect completely, as people respond to lower risk by changing behavior. As Atkinson 2021 points out, the economic intuition is straightforward. If closing bars and restaurants causes a prevalence of the disease to fall toward zero, the demand for costly disease prevention efforts like social distancing and increased focus on hygiene also falls toward zero, and the disease will return. You knew that was going to happen. It was going to be part of society. You can't necessarily avoid it. Fourth, unintended consequences may play a larger role than recognized. We already pointed to the possible unintended consequences of shelter-in-place orders, which may isolate an infected person at home with his or her family, where she risks infecting family members with a high viral load, causing more severe illness. But often, lockdowns have limited people's access to safe outdoor places such as beaches, parks, and zoos, or included outdoor mask mandates or strict outdoor gathering restrictions, pushing people to meet at less safe indoor places. Indeed, we do find some evidence that limiting gatherings was counterproductive and increased COVID-19 mortality. There's an interesting one for you. Finding some evidence that limiting gatherings, just even limiting gatherings, not just the lockdown, was also counterproductive. This is an interesting study. Let's see here. So I don't think I can go through all of this. Let's just finish up with the last bits here. In the early stages of a pandemic, before the arrival of vaccines and new treatments, a society can respond in 2 ways: mandated behavioral changes or voluntary behavioral changes. Our study fails to demonstrate significant positive effects of mandated behavioral changes, lockdowns. This should draw our focus to the role of voluntary behavioral changes. Here, more research is needed to determine how voluntary behavioral changes can be supported. But it should be clear that one important role for government authorities is to provide information so that citizens can voluntarily respond to the pandemic in a way that mitigates their exposure. Finally, allow us to broaden our perspective after presenting our meta-analysis that focuses on the following question: what does the evidence tell us about the effect of lockdowns on mortality? We provide a firm answer to this question. The evidence fails to confirm that lockdowns have had a significant effect in reducing COVID-19 mortality. The effect is little to none. All those lockdowns weren't worth a damn thing. Nope. Not according to this study, anyway. Not according to this review of many studies, I should say. The use of lockdowns is a unique feature in the COVID-19 pandemic. Lockdowns have not been used to such a large extent during any of the pandemics of the past century. Gee, I wonder why. However, lockdowns during the initial phase of the COVID-19 pandemic have had devastating effects. They have contributed to reducing economic activity, raising unemployment, reducing schooling, causing political unrest, contributing to domestic violence, and undermining liberal democracy. These costs to society must be compared to the benefits of lockdowns, which our meta-analysis has shown are marginal at best. Such a standard benefit-cost calculation leads to a strong conclusion. Lockdowns should be rejected out of hand as a pandemic policy instrument. I will link this in the description for you, but it was certainly fascinating. There's a lot of good, interesting stuff in here. I just provided the highlights for you to try and keep this particular video short. I encourage you to go back and read it. It is fascinating, and I didn't notice the thing about masking in there where they found only 2 studies that show any that used anything with masking in related to this also, and there was high benefit, but it was 2 studies that actually showed anything. And you know, they even show, like I said, the other gem in there was the thing about the compulsory limiting of gatherings didn't even help either. In different places, because you force people indoors, which isn't good, which doesn't help, and good grief. Okay. That's it for now. I hope this is helpful to you, and I encourage you to go have a look at this. This is my thoughts, and it's a big piece of scientific research and evidence with a huge meta-analysis going through as many different studies as they can that actually looked at this to show that the lockdowns, all those lockdowns that we did, really didn't help. And again, this is Johns Hopkins saying it, not me. Not me. I'm just reading the study. That's it. Until next time, like this video on the way out the door. Share the video, comment on the video, subscribe to the channel. Don't forget, come on over and join us on Locals for fun things there. Thursday review this week is going to be on transformational social emotional learning, a paper about that. So this ought to be interesting. Until next time, I'm Adrian, and I hope you stay curious, my friends.